Hello, I'm Dr. Jerry Devane, and if you don't know by now, I'm the chairperson of the COVID Task Force for your church. This week we have met in relationship to the new and ever-increasing outbreak of COVID in our community. If you're not aware, the hospitals are full of COVID patients. Other medical care has almost come to a halt. The hospitals in the region are full of COVID patients, and it is difficult to access medical care for other things other than the very essential medical issues. So as we have been facing this increase in COVID cases, we decided that a review of our activities at church was in order, and we have gotten together and decided on the following things. First off, indoor church will continue, but there will be a requirement for masking for all people above the age of 5 years. And that includes all people, whether you're vaccinated or not vaccinated. We know that some people will be unhappy with this, but we feel that it's important to protect those that are most vulnerable in our population and to protect those that have been unvaccinated as they proceed in and out of church. Children's church will now be able to be held. It will follow the same guidelines that we have for church. All children above the age of 5 will be masked. They will be socially distanced. It will be basically like the Sunday school activities that are going on now. Small groups will continue to be allowed. Once again, social distancing is important. Masking will be required. It is encouraged that if your class is able to provide for a Zoom option, that you do that, but it is not going to be required at present. CLC will continue to be held. The important change will be that teachers will all be required to mask at this time. Since all the children are below age 5, the masking in those kids will be optional, as the parents can get the children to wear masks. Outdoor activities are to be encouraged. On outdoor activities, there will be no mask requirement, but social distancing should be maintained. And by social distancing, I would say that at least 2 arm lengths, which means standing apart at a fist bump range with your arm fully extended, is appropriate to try to avoid transmission of COVID. Lunch Bunch is an important thing for our older population. Lunch Bunch is also a place where the more vulnerable will meet. Despite the fact that everybody in Lunch Bunch may have been vaccinated, we feel like that it poses some risk to them for breakthrough infections. So social distancing will be required. We will be requiring box lunches for all eating activities in the church. I know that some of these issues will meet with some disagreement, but I feel like that these are the things we need to do to keep everybody in our populations safe. Until the COVID epidemic has allayed, we're going to maintain our vigilance in order to protect our church members. I thank you for listening to me. If you have any questions, you're more than welcome to give me a call, and I'll be happy to discuss it with you. Thank you very much.